You have a different kind of medical practice. Were you a functional medicine doctor already at the time when you left the?
No, I wasn't because I started my practice in 2017 and I got my functional medicine degree in 2019. So
Mm.
I was not. So that evolved as I was working in my practice, that evolved. And gradually the functional medicine was added in. And I've continued to add pieces of that as the time has gone on. And we're always evolving in medicine. We're always learning new procedures. You have to stay up to date with things because things don't stay static. So, new transplant procedures that I learn all the time, new technologies, you have to stay on top of things. So that was added as I went along, and now it's evolved into this new company that I co-founded with my partner that involves the dental piece. So we're always learning, always learning. And the thing I tell my patients is, and the thing about me is if that I don't have the answer, I will find it. Like I have the resources and I will find it. So I think that's the biggest thing. You're not expected to have all the answers, but you're expected to care enough to figure it out.
And the business, the kind of business that you practice, it's definitely location based. But I am in North Carolina. Let's say can I benefit anyhow from what you offer?
Yeah, sure. So we do offer telehealth. So, for example, with aloneness, we offer telehealth. And I am licensed in North Carolina. You're not far from me, but but
Example, yeah.
yeah, this is an example. But for the examination of the eye and the mouth, you need to come in person at least for that visit. So we usually do an initial intake that we send to the patient that's pretty extensive for a whole health history. And that can be reviewed via telehealth if the patient is a distance away for the patient to determine if proceeding and coming and traveling for the examinations is worth their time if they would like to do that. So it can be started that way. And then after the initial examinations that are done in person, yes, it can be followed up that way too as telehealth.